This is Akashvani. In the program Spotlight, now we bring you a discussion on government's efforts for universal access to equitable, affordable and quality health services and infrastructure. The participants are Dr. N. K. Arora, Public Health Specialist, and Sonu Sood, Anchor.
To discuss government's efforts to develop health infrastructure and services in the country, Sir, Prime Minister Narendra Modi today inaugurated a new AIIMS in Jammu. On Friday, he laid the foundation stone of a new AIIMS in Rewari. And on coming Saturday, that is 25th Feb, Prime Minister will dedicate to the nation 5 new AIIMS located at Rajkot in Gujarat, Mangalgiri in Andhra Pradesh, Bhatinda in Punjab, Rai Bareli in Uttar Pradesh and Kalyani in West Bengal. 7 AIIMS in 10 days. How significant is this in the journey to fulfill government's dream of providing affordable, high-quality healthcare services to all, the dream of Ayushman Bharat, Viksit Bharat?
The whole philosophy of AIIMS is not just buildings. It's a paradigm and it's a thinking process that the world-class facilities are available to everybody in every nook and corner of this country. Many of these AIIMS are located in areas where nobody even imagined that there would be a medical college in that. Jharkhand, the example of Deoghar. Similarly, Rewari, again, it's an area which has been considered one of the not so well developed area in Haryana where there is a AIIMS. Jammu, and there is a new AIIMS coming up in Avantipur, Kashmir Valley. So this whole spread out of over 20 AIIMS across the country is to provide world-class facilities by creating an ecosystem which encourages innovation, which encourages to have the highest level of intensity for clinical care and also find answers to our nagging problems of that area. So we find that, in fact, I'm a product of AIIMS New Delhi by itself. And that was the time when it was the only one. And now we have AIIMS all around. So this philosophy has been expanded. And I can assure you that it is not only a great boon for professional and health sector, but for the community, it is such a big relief that now at their doorstep, we are finding these institutions which can provide care parallel to anywhere in the world, not only in India.
And so you talked about the transformation of India's healthcare ecosystem. So under PM Ayushman Bharat Health Infra Mission, the Prime Minister will also inaugurate many new medical colleges and many new nursing colleges. How important is this, you feel, to nurture the next generation of doctors and healthcare professionals in the country?
So I'll give you some statistics, which is astounding. In 2009, India had capacity to have 28,000 doctors per year. And out of these 28,000, 8 to 10,000 were leaving India for greener pastures in other countries. So we were left with just around 20,000 doctors. Now from 2009, today we are 2024. It's 15 years. But during last 10 years, many of us may not be aware that today our MBBS capacity is 110,000. From somewhere around 28,000, it has become 100 and almost 4.5 times. Equally important is that postgraduate seats, they used to be just 13,000. And today we have postgraduate seats between 70 to 75,000 per year in this country. So there is a total transformation which has occurred. The number of medical colleges, more than 650 medical colleges in this country. So this transformation is so critical because actually we require roughly 3 million doctors in this country, but we have around 1.8 or 1.9 million doctors. So if we have to bridge this gap, there needs to be a kind of a revolution in health sector training. And some of the good examples is in those states where the medical colleges are high, you find that even in district and sub-district and taluka, you have trained MBBS and MD or postgraduate trained doctors available. With the same philosophy, this government is going ahead that every district should have at least one medical colleges. There are several districts, we have more than one, but every district, so even remote northeast areas also, now we have medical colleges, and which is just transforming the health scenario in that country. Anywhere where medical college, I am associated with some of the medical colleges northeast. Nagaland has medical college, Mizoram has. I understand even Arunachal will have medical colleges. So what is this happening? That it again changes the health scenario and also the health expectation. So when we talk about Ayushman Bharat program, so on one side, it is not that just I provide the facility that they can get treatment, but I am also seeing that the system is providing a platforms where treatment can be provided and the highest quality of treatment. Northeastern part of India has one of the highest incidence of cancer. And we find that during last 3 4 years, a chain of over 20 hospitals have come up in that area. So according to regional requirements, the health facilities are being created. So on one side, we have doctors, which are there is more capacity and training capacity of having more well trained physicians and specialists. But simultaneously, the infrastructure for having more nurses and other paramedical staff in the country has increased by several folds during last 8 10 years.
In fact, sir, another aspect of this targeted approach which you have highlighted is seen in the health welfare schemes under central government's National Health Mission for new mothers, for children, for infants, for nutrition, for prevention of communicable and non-communicable diseases, immunization, in providing free, affordable medicines and diagnostic services to eligible beneficiaries. In this context, if we talk about the flagship scheme, Ayushman Bharat Prime Minister Jan Arogya Yojana, it is in its sixth year. And how do you see this scheme where, 5 lakhs per year per family health services are provided free and cashless? How important is this in our country?
I think you have to be a poor person to really even appreciate the benefit. In fact, we are working in Mewat area in Palwal. We have got about 250,000 population, which we have adopted. Similarly, we are working in Northeast Meghalaya in East Khasi Hills. And we have facilitated making these Ayushman cards. And you find that suddenly when there was a poverty looming on a particular family, or there was practically, they said it is better कि मर जाए तो अच्छा है, नहीं तो बाकी लोग बच्चों का और बाकी लोगों का क्या होगा. And with this card, you find suddenly not only the patient survives, but the whole family's life is prevented from slipping into desperate situation. So I think this is a game changer of sorts. But simultaneously, as this whole scheme is coming up and is moving forward, more and more beneficiaries are getting benefit out of it. It is also generating a demand that our population community requires infrastructure where they can get the appropriate treatment, whatever is required on that particular day. So this is one issue. But simultaneously, another very important thing, which is practically taking the healthcare to the doorstep. You must have noticed if in your household itself, if somebody is sick, you sometimes feel that if there was a doctor next door, it would have been much better. So for our population now, we have Ayushman Arogya Mandir, which is health and wellness centers. There are 1.6 lakh Arogya Mandirs now. And they are being made functional so that they not only treat women, mothers, children, adolescents, but also elderly, chronic disease, and they are being digitalized so that digital consultation is possible and they can be linked to the specialist care. So for every 5,000 population, this structure is in place. And I'm sure over next 1 or 2 years, when they really become vibrantly functional, people will feel that the health services are right at their doorstep. They don't have to walk too much and they can get consultation for even complex disorders. Chronic disease is one of the focus areas for these Arogya Mandirs.
And also Jan Aushadhi Kendras, they are also a big boon, you would say, for the entire populace. Under this Yojana, in the last 9 years, number of Jan Aushadhi Kendras have increased from 80 in 2014 to more than 10,000. And the target is 25,000 by 2026. And they are spread in 785 districts. How important is this, where generic, affordable medicines and surgical devices, they are available and the patients are able to get them at a very concessional rates?
We need to understand two things. One is India is already known as the pharmacy of the world. We have now infrastructure and R&D capacity for pharmaceuticals, as well as we have seen the experience in COVID that we are the forerunner vaccine manufacturer and R&D hub for vaccines. So by very nature, the cost of drugs and pharmaceuticals and devices is much lower in our country. Now, on top of this whole philosophy of Jan Arogya Kendra, this is again which makes it really one has to again see that how much difference it makes not only to the poor, even to the middle class and upper middle class. And the other important reasons that India is kind of capital for many of the chronic disease, hypertension, diabetes, and these individuals require drug through their life. Till the end of the day, they need drugs, and these are very expensive. But because of these infrastructure, Jan Aushadhi Kendras, the drug has become affordable not only for poor, but I think middle and upper middle class also, because otherwise they are extremely expensive. Many of our international friends come to India and they carry their supplies for 1 or 2 years from these Jan Aushadhi. I'm just saying to what extent this is attractive for everybody on this land. And even some of our friends in other low and middle income countries have been talking about to take this as an example, where again India seems to be taking a leadership that how the connect with the community and understanding their difficulties can be understood by the political system, by the policymakers, and make their life much more comfortable and think about wellness in a more holistic manner.
So, the rising medical tourism in India, how do you see the government's Heal in India mission, where they have brought in the Ayush visa, which makes it easy for foreign nationals and the objective being to promote travel healthcare. So, how do you see this? What is the potential and how important is it for the rising stature of India as a powerful economy? So, healthcare sector is also a very important part of our economy.
Several studies have shown that the health industry in India is a sunshine industry. And one of the major reasons for this is Heal in India. And the other dimension is Heal by India. So Heal in India provides the opportunities, whether it is Ayush-based treatment or even the allopathic treatment. We provide the uniqueness, the highest quality, which parallels anywhere else, and the cost advantage we provide. And I would say a highlight of Indian health system and doctors is that very personal touch when we deal and interact with our patients. And this is very attractive for our international patients. And this is a huge industry, but this can be a substantial contributor to our foreign exchange and to our GDP, that the resources it can generate. The other dimension is Heal by India, and where we are now started working in terms of manpower, particularly paramedical and paraclinical. So on one side, it is providing job opportunities within India, but even outside, because a lot of Indians, both doctors and non-doctors or paramedical, are working across and they are very highly regarded. For example, girls from Nagaland were trained in Japanese and then they went to Japan as nurses. They were nursing students, but they learned Japanese. And then, so both Heal in India and Heal by India, the overall philosophy is that by 2047, Indian health system should be among the best in the world. And we should not only be best in terms of quality, but most attractive in terms of the cost and the expenses associated with remaining healthy and well.
Dr. Arora, thank you so much for giving us a deeper insight into the rapidly transforming health landscape of India, where affordable, high-quality healthcare services are strived to be provided to all.
Thank you very much.
You were listening to a discussion on government's efforts for universal access to equitable, affordable and quality health services and infrastructure. The participants were Dr. N. Arora, Public Health Specialist, and Sonu Sood, Anchor. This program was produced and presented by the News Services Division of Akashvani. You can listen to it on our mobile app, News on AIR. This program is also available on our YouTube channel, News on AIR Official. You may share your feedback about this program through email at airnsdtalks@gmail.com or WhatsApp on 9289094044.